Driving hundreds of kilometers to see a doctor has been part of life in rural Saskatchewan for decades. But now, this.
Come here, baby.
From her living room, Marie Trafford diagnosed virtually.
It has saved me like a lot of money because I haven't had to close a business down just to go to the doctor.
Before the pandemic, Saskatchewan physicians had no choice but to see patients in person. The province wouldn't pay them for virtual care. The pandemic forced that change. Amy Van Vleck works from home with 3 dogs and a son who's homeschooled. A doctor diagnosed her with shingles virtually and renewed her prescriptions.
Why should I have to go all the way there to sit in an office and have them go, okay, I'll give you 3 more months and then you leave? It's such a waste of time for everybody.
Now the government has launched public consultations to decide what happens post-pandemic.
A lot of the doctors prefer in-person visits, especially if it's a patient that has some specific ailment and they need to get hands on the patient.
It's a conversation happening across Canada.
We need to make sure that we aren't leaving people behind.
The Canadian Medical Association just published a report that flags worries over standards of care lagging.
The proliferation of sort of a virtual walk-in care model via telehealth, that will not be high-value care for most Canadians. So we need to be very careful that virtual care accompanies a doctor-patient relationship.
In other words, some things are best done in person, but for others, the convenience is just too good.
I honestly think it's probably the best thing to come out of the pandemic, if you will.
Figuring out when it's appropriate to see your doctor from home, how often, and how much the doctor gets paid, all part of redefining the healthcare system. Bonnie Allen, CBC News, Meadow Lake, Saskatchewan.